Multiple counties across the state, including Kern County, have been shut down due to the governor's latest stay-at-home order. This comes as we are inching towards an announcement on a COVID-19 vaccine here in California. And joining us this morning to talk a little bit more about the state's response to the pandemic is Dr. Elaine Batchelor, the CEO of Martin Luther King Jr. Community Hospital in Los Angeles. Dr. Batchelor, thank you so much for being here.
Thank you for having me.
We've been talking more about, especially here, since we're impacted directly and down in Southern California as well, the regions that have fallen below that ICU mark that was put forth by the governor's staff of at least 15% availability. Let's just talk your region to begin with down in Southern California. Is that number continuing to plummet, and what is the true danger associated with that?
Yes, thank you for asking that. We are in a very dangerous situation here in Southern California and across the state with the fastest increase in COVID cases that we've seen since the pandemic started. Our hospitals have rapidly filled. We are starting to run out of ICU beds. And the danger is that we won't have space and staffing to take care of patients who are sick and need to be in the hospital. And if that happens, we'll see the death rate starting to climb. So we really need to take action to stop this from happening.
When you look at the San Joaquin Valley region specifically, our number, the lowest, we'll get new numbers obviously later today, but the lowest number of availability. But in Kern County specifically, when you break it up, Kern County was up at 19% availability. Can you talk why it was necessary to group counties into regions rather than continue to do this individually?
Well, one of the things that we've seen happen during this pandemic is some hospitals have filled up while other hospitals have continued to have some capacity to care for patients. So we want to make sure that within a region, there is still capacity to care for patients. Patients do get transferred across county lines sometimes, so grouping the regions geographically makes sense.
County Administrative Officer Ryan Alsop here in Kern County had mentioned that it was about 19%, but he also said that we have a facility set up for potentially an overflow type situation, and that they had reached out and had gotten into a nurses network where they can go out and get more nurses if need be in that area. Are these types of things taken into consideration at the state level when they look at areas when they're shutting things down like this?
I believe they would, because that would be part of what we would call the denominator, the number of beds that are available. And the state and the local public health agencies are reviewing capacity on a daily basis. So all hospitals are required to report every day how many COVID patients we have and how many ICU and hospital beds we have available. So they're looking at all of that information as they make decisions.
Well, we saw the spike over the summer right after the 4th of July. We saw another jump after Thanksgiving. Are you already planning and expecting another jump after the Christmas and New Year holiday? And can we expect another type of 3-week shutdown then?
Well, we are not fully into the post-Thanksgiving jump yet. The incubation period for COVID can be up to 2 weeks. And then typically it may take another 2 weeks for people to get sick enough to need to be in the hospital. So we won't see the full effect of Thanksgiving until around Christmas time. So that's why you're seeing the strong reaction now, because we are on the wrong trajectory now. We are having this incredibly fast increase already. And if we continue on this trajectory, our healthcare system will be overwhelmed, and we will see the number of deaths going up. There is light at the end of the tunnel, though, because we know that the Food and Drug Administration is reviewing the first COVID vaccine candidate today, and we expect to hear by the end of the weekend the FDA's decision on that vaccine, and it's all ready to go. They've already started manufacturing, and they'll start shipping those doses, and we will start giving the vaccine.
Dr. Elaine Batchelor, we want to thank you for your time this morning, CEO with Martin Luther King Jr. Hospital down in Los Angeles. Thank you and happy holidays.
Thank you. Happy holidays to you too.